When choosing an IV fluid solution, we look at the tonicity or amount of solute dissolved in the solvent. If you remember back to your chemistry days, that should ring some bells for you. In other words, how much stuff is in the liquid. Isotonic solutions match the concentrations of the blood. Because everything matches, there will be no shift in fluid. Things will stay where they are, just volume expansion. Hypotonic solutions have less of the stuff and mostly liquid. When you administer a hypotonic solution, that excess fluid or water has to find somewhere to go, so it typically forces its way into the vessels by osmotic pressure. It's always going to move from an area of low concentration of solute to an area of high concentration of solute. When it needs to come out of the vessel, it typically goes into the cell. So you will see some rehydration of dehydrated cells or swelling of normal cells. Hypertonic solutions have more stuff, less liquid. To create that balance, the water gets pulled into the vessels to balance it out. That means it pulls it out of the cells. This is used for severe edema, especially in cases of cerebral edema. You might give a very high concentration solution to a patient with cerebral edema. Once the fluid is in the vessels, we can diurese it out of the body. You may also use IV solutions that contain 5 or even 10% dextrose to treat hypoglycemia, but be sure to know their tonicity and what to expect in your patient. It's possible, guys, that if you work in a situation where there's maybe less experienced providers or providers who are just starting out, that they might still be learning how this all works as well. So you as the nurse at the bedside, understanding this information, don't be afraid to speak up and to say something. Once had a provider write an order, this was a physician in training, write an order that they want us to flush the gut with sodium chloride, and how detrimental that would have been to the patient. We called the attending physician and obviously got it all straightened out. But make sure that you understand tonicity, you understand osmotic pressures, and you understand conditions where you would use one or the other, because it's so important for your patient. And it's okay to question an order, even if it's truly just to seek deeper understanding. Ask the provider, say, hey, I don't understand the purpose for this. Can you explain it to me? If you don't feel comfortable with that explanation, keep moving up the chain of command until you feel comfortable providing the solution your patient needs. IV solutions are medications. Don't treat them lightly. It's so important that we're getting the right fluids with the right patient for the right condition for the right purpose.